In this last video, I have discussed about in general considerations of any animal models for any particular disease. In this videos, I am going to discuss about CVS disease model. In CVS disease, there are many diseases. The well-known diseases are your hypertensions, your hyperlipidemia or high cholesterol, congestive heart failure, heart attack. There are so many disease under CVS disease. So I am going to discuss about major disease. Particularly, first I am going to discuss about hypertensions. Animal models for the hypertension. So animal model for the hypertensions are your. There are various models. One is Rino vascular hypertensions models. There is a DOCA salt induced hypertensions in animals. There is a neurogenic hypertensions, neurogenic models for hypertensions. There is a genetic models also for the hypertensions. So these are the various animal models for the hypertensions. So one by one I am going to discuss about. First is renovascular hypertension. As its name indicate, renovascular. Okay, before that one, doing the animal models, you have to be randomize the animals. You have to take uniform weight animals. These are the basic considerations. So in Reno, as its name indicates, it's a renovascular hypertension. So name indicate you are going to do something with the renal and vascular system. So this hypertension is produced by doing the vasoconstrictions of renal arteries. So this hypertension in animal is produced by constrictions of renal artery, constriction of renal arteries. The renal artery constrictions will result in the activations of RAS systems, activations of renin, angiotensin, aldosterone systems, and also activation of sympathetic system, and ultimately increase in BP and hypertensions. Right, so this is its mechanism, how it's going to induce the hypertension, renovascular hypertension. So method is how you are going to do the constrictions of renal arteries. So first step is in method. First step is, you know, because you are going to do a surgery, you are going to constrict the renal arteries. So you have to be anesthetize the animals first with a suitable anesthesia like phenobarbital. Then you have to be put a silver clip of 0.2 mm internal diameters, which you have to be placed on left renal arteries, So due to this putting the silver clips, so systolic blood pressures, biomarker is systolic blood pressures when increased more than 160 mm of mercury for 2 consecutive days, and this not happen immediately. This blood pressure, systolic blood pressures will not increase immediately after the ligations of after 4 weeks of ligations. So duration of after 4 weeks of ligations. So means silver clip you have put it 2 mm internal diameter on the left renal arteries, and after 4 weeks, if blood pressure is systolic blood pressure is increased more than 160 mm of mercury, and you have to measure for 2 consecutive days, and it's increased more than 160, that means this model is devolved, right? I hope it's clear. Another model is your DOCA salt induced hypertensions. DOCA salt induced hypertensions. DOCA salt, I hope you know, DOCA is deoxycorticosterone acetate. Deoxycorticosterone acetate. So this docasterone acetate salt induce a hypertension. So how it induce, for how you have to be induce method is, you have to be give 100 gram NaCl in a diet of the animals, normal diet of the animals, and or you have to give in a drinking waters 2% sodium chloride. So 250 gram around DOCA in a 10 mg per kg subcutaneous twice weekly for 4 weeks will result in a hypertension. So 250 grams DOCA. This is normal salt induced hypertension. If you are giving this for a I don't know exactly, I didn't remember what is the durations, but normal NaCl in the diet, it will result in increase in BP. In DOCA, you have to give 250 gram DOCA, in particular in 250 gram steroids. But DOCA, how much DOCA you have to give? 10 mg per kg subcutaneously. So you have to give twice weekly for a 4 weeks. Twice weekly for 4 weeks. So this will result in increase in hypertensions. Another model is, you can see more informations in internet or in books also, Google books. Neurogenic hypertensions. Neurogenic hypertensions, as its name indicates, you are going to do something with the nervous system. So this negative feedback, the negative feedback which control the BP, normally there is a negative feedback to control BP, baroreceptor in the carotid sinus sense. So you are inhibiting that feedback, so it will result in increase in BP. There are a genetic models, as you know, there is a major advantages of genetic models, you have read in other units also. So in genetic models for hypertension is SHR we called, that is the spontaneous hypertensive rats. So these are the models for the for hypertensions. Another CVS disease, that is a hyperlipidemia. I'm just going to briefly discuss about 2-3 disease models. Hyperlipidemia. In hyperlipidemias, what are the models? First model is, there is a tritone you are giving. If the tritone, that is the detergent, tritone induce hyperlipidemia in a Wistar rat. It induce hyperlipidemia. So how you give systemic administrations of this tritone, you have to give systemic administrations of tritone will result in a biphasic elevation of plasma cholesterol. So when you are giving this, then it will result in biphasic elevation of plasma cholesterol and triglycerides. So method is, you have to be first starvations for 18 hours, then you have to give methods. If you see how tritone X induce hyperlipidemia, in methods you can write, first you have to be do the starvations of animals for 18 hours, then you have to give IP 10% aqueous solution of tritone at 400 mg per kg body weight. After 24 hours you will find when you will measure, you have to collect the blood, and from blood you take the serum, and in serum you have to measure triglyceride, VLDL, HDL. Its level will increase. These are the biomarkers for that particulars. There are another models for the hyperlipidemia is, I hope you people have heard about this, cholesterol diet induced hyperlipidemia, or diet induced hyperlipidemia. You have to be give in a diet, cholesterol rich diet, and it will lead to your hyperlipidemia. There is a transgenic rat or mice also. In transgenic mice or rats for hyperlipidemias, particularly how they are inducing, there is a lacking of, in these mice there is a lacking of apolipoprotein E. So this lacking of apolipoprotein E will result in severe cholesteremia and atherosclerosis. So this is about your hyperlipidemic animal models. You can write about these things. Another is for CHF, or congestive heart failure. The animal model is you have to be do surgery, and endotracheal intubations you have to perform. That is we called endotracheal intubations you have to give. You have to be artery, you have to be ligated. Artery ligation you have to be done, means you have to be tied the arteries. So what if arteries are tied, it will lead to a ischemia, and ischemia is a loss of blood supply for a particular reason, and which will result into a CHF, congestive heart failure, right, in a coronary circulations. So ischemias and left ventricular dilations, impaired cardiac functions will be visible, and you can do these changes are visible by echocardiography. When you are ligating the coronary arteries, then by doing the echocardiography you will observe left ventricular dilatations. You can see clearly impaired cardiac functions you can see in 1 week, and this will absorb these changes, you will absorb 1 week after the ligations. 1 week after ligations you will absorb these changes. There is a other animal models for CHF or for heart failure is catecholamine infusions. When you are giving catecholamine infusion, it can also result. So this is about a brief discussion about the CVS disease models. This is your second last unit. And any animal models, it has to be simple to perform, it should be reproducible, and consume minimum quantity of the animals. So thank you.